Okay, we want to get to a big update on New York's vaccine distribution plan. The first vaccines could arrive in New York as soon as this weekend. That's earlier than expected. The vast majority of the initial 170,000 vaccines will go to downstate New York, including 72,000 in New York City. Governor Cuomo says nursing home patients and staff the first priority here. This comes ahead of a pivotal moment in the pandemic tomorrow. The FDA expected to authorize the Pfizer vaccine. Now, yesterday, the agency said the vaccine works and is safe.
But the vaccine is just part of New York's plan of attack. On Friday, the governor will announce a new plan to slow the post-Thanksgiving surge. We already know that indoor dining could shut down in the city as soon as Monday. As always, we've got live team coverage. We'll begin with News 4's Andrew Siff, who's in the Elmhurst section of Queens. Andrew?
David, as you'll recall, this pandemic began with the city's hospitals overwhelmed 9 months ago at the height of the pandemic, and now the hospitals again in the spotlight. 44 of them in the city equipped with special deep storage freezers that can handle the vaccine, scheduled to arrive by Tuesday. The rollout is only days away. Hundreds of thousands of vials of vaccine soon bound for New York. Pfizer expected to win FDA approval tomorrow. Then Sunday, the CDC final vaccine review. Then on Tuesday, the Pfizer vials arrive at hospitals in New York City and dozens of cold storage hubs across the state. 1 week later, the Moderna vials arrive. Today, the governor explained the order of who gets their shots first.
There was a discussion about, do you do the residents or do you do the staff? New York, we decided to do both, the residents and the nursing home staff. Then you go to high-risk hospital workers.
Health officials already confronting a challenge, a skeptical public.
I'm not sure. I think that I will wait for a little bit.
You would wait?
Yeah, I want to see the side effects on other people, and then maybe I'll take it.
We're going to need a real public education to dispel the skepticism that already exists.
Cuomo also for the first time spelled out when the general population can start getting vaccinated.
We're looking probably at the beginning of February on this schedule.
I think if the medical department officials take it and other professionals, then I think it's safe.
In the city, the health department today confirmed that all but one of its hospitals have the special cold storage freezers required to preserve the Pfizer vaccine, but with supplies limited at first. Today, I asked Mayor de Blasio if the rich and famous might try to get their shots out of order.
What assurances or promises you can make to New Yorkers that folks of influence won't jump the line and get the vaccine before those in the priority order?
We will not allow people who are privileged to jump the line.
And you can expect over the next 5 days both the city and the state with a more detailed schedule about how that first vaccine rollout begins next week. Live in Elmhurst, Andrew Siff, News 4 New York.
Andrew, thank you. Today we got a stark prediction of just how bad things could get in New Jersey this winter. The state laid out its worst-case scenario for COVID if we don't take action to slow the spread. The projection shows new cases peaking at 12,500, and that wouldn't happen until the middle of next month. Hospitalizations could peak at more than 8,700. Again, much of this is up to us. News 4's Brian Thompson continues our team coverage. He is in Toms River. Brian?
Yeah, Dave, and the fire continues to grow. Those are the words from Governor Murphy today, as we did indeed see for the first time the worst-case scenario projections made by state health officials. It is not a pretty picture. A stark warning from Governor Murphy today as he laid out a worst-case model for COVID-19 in the weeks ahead.
We cannot allow our healthcare system to get overrun.
The State Department of Health revealing a nightmare scenario showing more than 12,000 new cases a day and a record number of COVID patients in the hospital if people don't distance, don't mask, and ignore holiday gathering warnings.
They're models. They're not static. They change literally every day, and they improve the more we focus on social distancing, the more we wear our masks, the more we use common sense.
Testing is a key component, as it has been, so that people who test positive know to quarantine, know that they are dangerous to others. Ocean County now running this appointment-only testing center at its community college 6 days a week and planning an aggressive testing program over the next year, starting with one mega center.
This is going to be an appointment-based system, similar to what we've done with the college with our COVID testing.
But the vaccines can't roll out fast enough to stop the spread. An urgent plea from Governor Murphy.
And if folks out there are willfully behaving badly, shame on you. Shame on you, like leaving your jersey at home. And by the way, you're infecting the kid or the parent. I mean, who do you think you are? Come on. That is completely unacceptable.
That worst case scenario also includes hospitalizations, and they would reach the level that we did see last spring. That's the number. That's the magic number that Governor Murphy worries about. Because if it does, then he suggested he may have to retighten all of those restrictions that we had last spring and take us back to there. Live in Toms River, Brian Thompson, News 4 New York.
All right, we'll have to wait and see what changes here, Brian. Thank you for that. Also keeping a close eye on Connecticut this afternoon, just one day after the state's positivity rate reached new heights. We're still waiting for Governor Lamont to update the state's indicators here, as we do every day. But yesterday, you'll remember, the positivity rate was above 8.6%. The hospitalizations ticked up, and sadly, there were 18 more deaths. Also there in Connecticut, officials say that frontline healthcare workers could begin getting the COVID-19 vaccine as soon as this weekend. They expect to get those vaccine shipments within 24 hours after the FDA grants that emergency approval. However, we're told it could take 2 or 3 weeks to really vaccinate all of the frontline workers. First in line will be the people who treat the COVID patients, Dave.
New York City's former mayor Rudy Giuliani gave another update from the hospital this morning about his treatment for COVID-19.
I feel just about 100% right now. I'm gonna be discharged this afternoon. I'm pretty much 100%. I've got to quarantine for a few more days.
President Trump's personal attorney also told WABC 77 Radio that doctors gave him the same cocktail of medicine used to treat the president before the election. Giuliani was hospitalized Sunday after testing positive. The 76-year-old says he feels fine with no pains or fever, but a tiny cough that he says is going away.
Well, it is day 2 of the UK's vaccine rollout, and with things off to a promising start, it is expanding the launch today. But British health officials are also issuing a new alert about this vaccine. They say there are 2 new cases of adverse reactions, so they are warning anybody who has a history of severe allergic reactions to hold off on getting it. News 4's Rana Novini joining us from the newsroom to explain here. Rana.
And Natalie, both of those people were workers with Britain's National Health Service. They had a reaction shortly after receiving the vaccine. British regulators are now saying that people who have significant allergies should avoid the shot, but a local expert cautions there needs to be more of an investigation.
The coronavirus vaccine rollout continues for a second day in the UK. The elderly, vulnerable, and those who care for them among the first to be immunized. 2 British healthcare workers suffered allergic reactions after receiving the Pfizer-BioNTech vaccine. Now, health regulators in the UK say people with a history of severe allergic reactions to food, medicine, or vaccines should skip the shot for now.
We know from the very extensive clinical trials that this wasn't a feature.
Both workers have a history of serious allergies and carry adrenaline pens with them. Both expected to be fine.
Anaphylactic reactions or serious allergic reactions to vaccines are actually very, very rare.
Dr. Purvi Parikh is an allergist and immunologist who is a researcher in the Pfizer vaccine trials. She's surprised by the broad recommendations from British authorities.
It's dangerous to make these blanket statements without clarifying and without thoroughly investigating what happened.
Pfizer and BioNTech are working with investigators to better understand each case. Regulators in the U.S. have not made any recommendations for allergy sufferers, with the first doses of the vaccine expected to arrive in New York in less than a week.
I would caution that, people not panic until we actually have more information.
And Dr. Parikh also says that while people with serious allergies to vaccines were not included in the Pfizer trials, people with allergies to certain foods and medicines were included. And she says no one had a life-threatening allergic reaction to the vaccine. Reporting live in studio, Rana Novini, News 4 New York.
Rana, thank you. As the United States hits a new record of daily COVID-19 infections, the grappling over a stimulus package still continuing on Capitol Hill. The Trump administration offering a $916 billion package. It would send a $600 direct payment to most Americans, but it would eliminate a $300 per week unemployment benefit. Democrats, however, want to see that $300 unemployment payment reinstated. Senator Mitch McConnell sounded off on the stalled efforts this morning.
There's a huge list of helpful policies that both sides agree on. This need not be rocket science.
How can we, in good conscience, go home for Christmas knowing that the day after Christmas, 12 million Americans will see their unemployment insurance disappear?
A portion of the proposed stimulus package would also include an extension for not paying student loans temporarily until at least May of next year, Natalie.